Welcome to this episode of Ask the Male Fertility Specialist. I am Dr. Chua Ka-Hee from KKH. Both urologists and andrologists are medical doctors. An andrologist specializes in medical conditions affecting male fertility and sexuality. A urologist treats a broader spectrum of conditions, such as diseases and disorders of the urinary system and adrenal glands in both men and women. When a man cannot have an erection or ejaculation, then those are really obvious signs that he needs to seek help. Also, if he and his partner have been trying for at least a year and not been able to get pregnant, then there is also another sign that he needs to seek help because his sperm count may be reduced. Whenever you see a doctor for your male fertility, the first line test will be that of a semen analysis or a semen test. Okay, the parameters of a semen test are wide-ranging. For example, the sperm count can range from 0 to hundreds of millions. However, it does not mean that those with a very low sperm count definitely cannot conceive, or those that with high sperm count will definitely conceive. Okay, couples can seek help in government hospitals, for example, like KK Hospital, where we have a range of treatments for both the men and the women. Generally, in KKH, the couples are seen together. So if either of the couple partner has a fertility issue, the wife should go to the polyclinic to get a referral for subsidized care, and they can come together as a couple, where we will see both the men and women and assess both of them. Okay. Alternatively, the patient can just call in to make an appointment to see one of our reproductive health specialists, but that will be through a private care rather than subsidized. Fertility issues affect 15% of all couples in Singapore, out of which 30 to 50% are actually comprised of a male component. Common issues with the men include low sperm count or poor swimming of the sperm. There are many lifestyle factors that affect sperm condition. For example, smoking is known to be toxic to both the sperm as well as the eggs in females. Alcohol can reduce the sperm function as well as sperm movement. Obesity is another big risk factor where it can affect both sexual performance as well as the sperm quality. When the person is obese, they may have associated issues like erectile dysfunction or reduced sex drive, and all this is associated with lower male hormone levels, testosterone. Finally, some patients may take drugs either for recreation or for bodybuilding purposes, and this affects the sperm count, and it may cause it to drop to even very, very low levels or even zero. So treatment of male infertility, it depends largely on the cause. For patients with a previous operation like a vasectomy to tie off the sperm ducts, or if they had a recent hormone or steroid treatment, these can be reversed. For patients with male sperm problems associated with long-term conditions like obesity or diabetes, these can usually be improved with improvement of their chronic condition. For some patients who are more complicated, for example, they have an underlying genetic problem, these patients may often need to undergo IVF to help them get conceived. We usually do give some supplements for patients with mild to moderate sperm problems. However, those that have very, very severe problems, supplements may usually do not help, and they will need either surgery to recover the sperm or they will need to undergo IVF. Worldwide, in many developed countries, we are facing a decline in fertility, and Singapore has not been spared as well. SGH and KKH, we are doing a study collaboration. This study aims to increase the fertility health awareness in young couples, and in so doing, improve their parenthood intentions, and hopefully they can start having children at a younger age. So for anyone who is interested, or if you have any friends or relatives who are interested, please tell them about the study, and they can go to the website to look for more information and to speak to our coordinators who can help them. At the male fertility assessment, the very first test will be that of a semen analysis. The components of the semen analysis include the volume, the count, and the swimming. Okay. Generally, if all these components are fine, then there is nothing further that needs to be done. However, if there is if there's any problems with any of these parameters, then more tests may need to be done, such as ultrasound scan of the testis, blood test to check the hormone levels, as well as a genetic test to see if there's any underlying genetic problems. So whenever we ask for a semen analysis, usually there will be an abstinence period before it's, and this generally is about 3 to 5 days. Then after that, the man has to go for 3 to 5 days without ejaculation. Then they will give us a sperm sample, and that is the perfect time to analyze the sperm. The answer is a resounding yes. Most men do have low normal forms seen on the sperm test, also known as morphology. This does not seem to affect the ability of the couple to get pregnant. Neither does it affect the health of the future child. Age-related fertility decline affects both males and females. Females, after 35-year-old, the drop-off is much faster. For males, the sperm quality and the sperm count has a more gradual deterioration with age, such that there is no real cut-off point. But definitely, a man in the 40s, the sperm function will be a bit less than one in the 20s. As for whether there's any birth defects, so far there's been no strong link between male age, paternal age, and birth defects. There are some studies that say that there may be a higher risk of autism in children born to fathers who are more than 45-year-old. Lifestyle modifications are a great way to improve the sperm count and function. Smoking and alcohol are toxins, and these should be best avoided. Prolonged heat exposure to the testicles, such as the sauna or long-distance cycling, or even tight underwear, should be avoided. And lastly, healthy lifestyle and healthy diet and moderate exercise, not only do they improve the sperm function, they also improve male hormone levels. It's a natural boost to male hormone levels, and this will both increase sexual performance as well as sperm counts. There are many supplements for sperm health, and these are available in majority of the pharmacies, and they are actually over-the-counter medicine. And these are actually supplements rather than medicine. They are usually a combination of vitamins, such as vitamin E, minerals, such as zinc, and antioxidants, such as carnitine. Studies have shown that these may improve the sperm function in patients with mild male problems. However, in those with very severe conditions, these are usually not of much help. Okay, and a word of caution is that some of these, there are so many supplements, and some of these are even available online, and you're not sure what really goes into them. So some of the supplements have been found to contain traces of hormones or steroids, and these can actually have the opposite effects of reducing your sperm count if you're not careful. So always only buy from approved sources, or if you're not sure, you can check with your doctor before taking them. So the usual time for them to take effect is at least 6 weeks to 3 months, and you can actually continue them for longer if you like. So testosterone is a male hormone. It's very, very important for a range of functions, such as energy levels, sex drive, even how strong your bone is. Also, it is dependent on testosterone. So a person who has low testosterone, he may start to feel that he feels tired the whole day, or he feels that he has very low or no interest in having sex. he might find that he is losing his erections, and is no more morning erections, and during sex his erection is cannot maintain or is weaker than usual. Okay, so these are the signs of early signs of low testosterone. Of course, when we do a sperm test, then you may also see that the count might be reduced. Okay, so at KKH, to determine if a patient has low testosterone, we need to do a blood test. If the blood test is low, then we can diagnose the patient to have testosterone deficiency. Okay, and it depends on what is the cause. Some patients who have high BMI, and they're not very active. The first line would be to try to reduce their weights and to do more exercise, and this is a natural way to boost the testosterone. Okay, other ways would be to take medicine. However, have to be very careful. The medicine that we give increases the testosterone indirectly through brain functions. You cannot take testosterone directly into the body. This will have the effect of reducing your sperm count or even dropping it to zero. Okay, so regular moderate exercise is best to have a sustained release of testosterone. Okay. Some patients may think that more is better. So, but that has not been shown to be the case. For example, very, very high intensity exercises has been shown to temporarily reduce the sperm count. Okay. Also, long distance cycling may not be so good for the testicles because it will increase the heat around the scrotal area. So, if you want to cycle, you can, but do everything in moderation. For example, maybe one or twice a week, and maybe not more than one hour each time. Delayed ejaculation is a condition where it takes some time for the male to achieve ejaculation. Okay, and it is longer than usual, and sometimes the man does not ejaculate at all after a period of sexual intercourse, also known as anejaculation. This is very frustrating for both the male and the female partner. To properly manage these patients, we need to take a full detailed assessment to find out what is the cause. They can be hormone-induced, could be due to drugs, or it could be due to previous operation affecting the nerves around the area. Delayed ejaculation can be due to age, stress, or lifestyle as well, in which case this is usually temporary, means that the patient was fine before this, and for an acute period, maybe a few weeks to months, then they experience this problem. If that is the case, usually with improvement of the aggravating factor, the condition will improve as well. Treatment will be depending on the cause. It will be usually a combination of both medical as well as behavioral therapy. However, these will take a lot of time and patience for the treatment to see effects, and it is not something that can be cured overnight. Okay, we do have many couples with fertility problems, including many husbands with low sperm count. However, with treatment, a lot of them do manage to conceive and have a child eventually. So I would say never give up hope, because even men with low sperm count still can conceive children, either naturally or through assisted reproduction. Thank you for joining me in this episode of Ask the Male Fertility Specialist. I am Dr. Chua Ka-Hee from KKH. Take care and stay safe.